Hi there, I'm Sara Sheehan, and welcome to my podcast, Transformational Thinkers with Sara Sheehan. Today I'm talking with Dr. Kerriann Greenhalgh. Dr. Greenhalgh is a wife, mom, and the inventor behind KeriCure's Medical's technology. Dr. Greenhalgh received her bachelor's in biochemistry and a PhD in organic chemistry from the University of South Florida. She was an initial member of MyMedics Incorporated, and as a lead of R&D and product development, and she successfully submitted the company's first 510K to the FDA for a collagen surgical mesh. Her experiences working on projects for the FDA, Homeland Security, U.S. Army Medical Research Center, and with industry leaders, including Battelle and Constellation, have given her the insights on how to develop and launch critical need products successfully. She has been invited to be a reviewer for multiple NIH grant review panels, scientific journals, an established author and contributor to many medical and scientific journals and publications. Dr. Greenhalgh holds over a half dozen patents, including many for the KeriCure technology, and is a frequent keynote and guest speaker at symposiums and conferences. Dr. Greenhalgh brings unique expertise to KeriCure as both the CEO and Chief Science Officer, dedicating her life to developing safe, natural, and effective skin and wound care products for the world. Kerriann, I am so honored to have time with you today. Welcome to the show.
Thank you. Thanks for having me, Sara.
Thank you so much for your time. Kerriann, your backstory is so incredibly important because it clearly is what got you here. And you clearly followed your passion for science along the way. Can you tell us your backstory and how it led to where you are today?
Sure. So I always had a passion for chemistry, even in high school, actually. It was one of those classes that, everyone was afraid of. And when I got in, everything just clicked and I understood the language. So it came very easy to me. And I said, I actually finished the class like 6 weeks before everyone else because my teacher let me work ahead.
Awesome.
Yeah. And so
That's
it was one of
incredible.
those things where it's like, okay, everyone else around me is struggling and it came naturally to me. So this is probably something I should. And so I actually declared chemistry as my major my first day at USF, University of South Florida, go Bulls. And I was I had a professor and I got to take an advanced level class. And he talked me into doing internship over the summer working in his lab. And this was the end of my sophomore year. So I was by far the youngest person in the lab by a lot. And by the end of the summer, he sat me down and said, what do you want to do? And I was really interested in forensic science. And so I thought I was going to be a forensic chemist. And he said, well, after, 8 weeks of summer, you have enough for a master's. I was like, you're kidding me.
Wow.
He's like, you synthesized 10 compounds and tested all of them. He's like, that's a lot. Like most people take 2 years to do that. I was like, oh, okay. So he talked me into going to grad school basically after that summer. And so I ended up finishing my undergrad in 3.5 years and was working in the lab the whole time after that. And so had a head start with my PhD. And what our lab was focused on was a nanopolymer drug delivery system. So we were trying to find a way to make penicillin active again against staph and MRSA. And so we used this really unique nanopolymer system. And what I was working with it, I was trying to address the very multitude of bacteria that inhabit burn wounds. So my focus was specifically on topical applications and for burns because I had an NSF IGRT fellowship and we were supposed to be doing something with the skin. So I was like, oh, you guys are trying to treat internally. Let me go topically, which turned out to be the great thing because it just kind of kickstarted everything I ended up doing with KeriCure. But yeah, so I've always had a passion for burn wounds, especially. I saw how devastating they are to people and how much contamination they get so quickly and how difficult they are to treat. And they're really, no one gives it a lot of love and attention. If you look at the wound care industry as a whole, burns take up 10% of the innovation and technology and products that come out. And, that just didn't make sense to me. And so I've always had an interest in that area. And after I graduated, my first interview out of grad school, I had to pitch not only myself, but my technology as this nanoparticle drug delivery system for topical wound care to a company. And they ended up hiring me. And then, of course, shelved the technology to do other stuff and got them their first 510K. And then they wanted to relocate to another state. And I was kind of done. So good time to part, and was the kind of the kickstart I needed to push me out and start my own company and see if I couldn't do what I wanted to do after learning a lot from this company on how to get FDA clearance, how to develop the whole design history file and develop and do all the testing needed for FDA. Got a lot of education in that. And so it was the right time to kind of branch out on my own and see if I can do it for my technology. And so that's when I formed KeriCure in 2011.
That is a fascinating trajectory. And I would also add, it's very impressive that things came naturally for you and were uniquely fueled and sped up. I find that fascinating.
Yeah, I always was a big science nerd, though. I mean, I think I was part of Greenpeace and like 10, and always into the environment. I used to, hang out in the woods and do all sorts of hunting. And I had my own microscope in elementary school. And when, those weren't cheap or very easily accessible on Amazon. That wasn't a thing back then. I had my big science kit and I would do experiments at home, which, my mom loved, which now I get to do with my kids. So it's full circle, and they're big science nerds too, which is great. And we do slime and, I make elephant toothpaste and we do Mentos explosions and all sorts of fun kid stuff at home.
Well, and I'm sure they are great testers of your products as well.
Oh, yes. Between them and all the animals, yeah, we've actually I've developed because of them. My daughter, we found out when she was just turned 2, she stepped in a fire ant hill in the backyard and ended up having a really bad anaphylaxis reaction. Everything started swelling, and luckily we were having a hurricane party. So had a lot of neighbors over, and a lot of them are nurses. And so they were like, jumped in the hot tub to get her, to calm the itching. They gave her Benadryl, and they calmed me down because I was panicking, obviously. But then the after effect of the ant bites is the itching and the blisters. And then and she'd scratch them and it'd come open. And I was like, you know what? I remember at some point in time, we had looked at adding lidocaine in for itch and pain relief. And I was like, let me revisit that. And so I ended up developing the line with lidocaine because of her in 2019, actually.
It's a wonderful new addition. I'd love to hear more about the nanopolymer technology behind KeriCure.
Absolutely. So what we have is a really unique polymer system, and I basically designed it to mimic the elasticity of the skin. So the polymer that I created is an acrylate polymer, acrylate-based polymer, but it has the same tensile profile, meaning it can stretch and pull and then go back to its original shape, which is the same as elastin in your skin. So that's why your skin can stretch and bend and move and go back, which we all lose when we get old, sadly. So what I wanted to do was make something that wasn't like the new skins, like the super glue style products. It's not a dermabond. You're not going to be like, ow, I just glued myself together and it hurts and it irritates. So we wanted to be more kid friendly, and that having the ability to stretch and move with the body so that it doesn't irritate the skin and is comfortable for, everyone, not just people, but kids with autism, so that they don't notice it. People with sensitivities, elderly who want to rip a Band-Aid off the second you put it on them, and then it tears their skin because they have thin skin. So we were able to target initially, when we first launched commercially with our spray on liquid bandage, those more niche individuals because we were comfortable, we were safe, we were kid friendly. We didn't have harsh chemicals in it. We're a water based product. So it's essentially a water based system that you spray on and then it deposits a polymer film. And the film dries on the skin surface and acts as a physical barrier to prevent bacteria and infection from getting in. So it basically seals that wound and protects it and provides some moisture, which is ideal for healing, helps with itch and inflammation. It just calms everything down because of that moisture soothing capabilities. And I don't know if you've ever used like the new skin products. It's alcohol and super glue. It burns.
Right.
And it sucks.
It's not a very good experience,
No,
is it?
no, it's not kid friendly.
It's not
Yeah.
at all.
So I always joked, I said, like they're like super glue. We're more Elmer's glue. We're more natural, kid friendly style.
Well, and I would think with blisters and things like that, it'd be absolutely ideal.
Yeah. Oh yeah. And we have, we used to sponsor Ironman events and they would use it to prevent chafing. They'd use it on the blisters. I had one event where we had a booth there and all of a sudden someone's yelling, where's the liquid bandage company? Come here, we need you. And someone was coming across the finish line bleeding and we had to triage them right there. No. We've had some fun experiences along the way. And I've always had an interest in a solid foundation of knowledge in medical, but I never wanted to be a doctor. So this is like my perfect in between because I get to do a lot of medical fun stuff, but I don't have to treat people.
That's amazing. And so when I think about your product and I think about the applicability in the marketplace, obviously elder care, anyone that is in harm's way in a tough job, whether it's police or firefighters or EMTs, as well as military.
Yeah.
And honestly, any school environment with kids.
Yeah.
Those are all critical consumers that can use your product, correct?
Yeah. I mean, that's the thing about first aid. It's not limited. You can think of a million different ways we can use the products. And, it's a great thing, but it's also a challenge too, because it's how do you focus your time and energy when you can be used in so many different avenues. If you think just retail alone, there's obvious retail of grocery and pharmacy, but then we're applicable in the outdoors and adventure category. So you're, talking Sports Authority. I think that's still around. Dick's, those places, the hunting stores, the big Bass Pro Shop kind of places.
Sure.
First aid, think of like your industry first aid. So at manufacturing facilities, workplace first aid, there's just a gazillion different things and different channels to look at on that side. When we went down the OTC route for a while, we are still commercially sold on Amazon. And that ended up just being easier because people can get it next day. They're going on and they're searching for this specific thing. What we found when we were in the first aid section in, the pharmacy and grocery stores were people didn't go and shop for it. They were going because they needed it. So it wasn't something that sold routinely because it was only if someone had an issue, they were going.
Interesting.
And then it's if they can get to it and if they have a store close by and, and if there's not something more convenient. So what we found with Amazon and with the online retailers where people were able to have that convenience as soon as they needed it and they only had to wait a day. If that, if that, sometimes you get Amazon the same day. So that's really we decided to kind of focus our efforts there where we had less time and distraction of dealing with the retail space. Amazon's fairly self-sufficient once you get it situated and know what you're doing. And we've been there since 2013. So we're one of the oldies with it at this point.
That's impressive for Amazon.
Yeah.
And so that means that Amazon is doing the work of getting it into consumers' hands.
Right.
And all you have to do is provide inventory to them, correct?
Yeah. Yep. And we manage our listings and all of that. But yeah, it's nice because it's, small businesses are able to put their products on Amazon and get sales. Whereas most
Mm-hmm.
small businesses can't get into big box stores and retail. It's very challenging. And
Mm-hmm.
it comes with a high cost. So, I always say, people complain about Amazon and they're being them so big. And I said, well, if you look at it and actually look at who the sellers are, you'll see a lot of small businesses on there. I know we get a little
Right.
badge that says we're a small business and we're a woman-owned small business also.
Mm-hmm.
So if you
Mm-hmm.
look on there and you're conscious of that, you can really shop small business and be
Mm-hmm.
beneficial to us small guys through
Right.
Amazon.
And so, besides selling through Amazon, you also have two websites. Your
Mhm.
KeriCure focused on consumers, and then your KeriCure Medical.
Yes. Yeah, and we kind of separated, we wanted to have two distinct areas for the specific end user.
Mm-hmm.
So we have our consumer facing website, which focuses on our OTC, our spray on bandage products that have either the silver or they have lidocaine for itch relief, for blisters, for cold sores. It actually works great on cold
Mm-hmm.
sores. Go figure.
Really? Wow.
Psoriasis, eczema, like really any topical issue you can
Mm,
find. We've used it on and it's helped. Poison ivy, all sorts of crazy stuff.
amazing.
But we also have our animal health line there too. And that's actually our top seller on Amazon is our pet products. Because if you think about it, you can't put a band-aid on a dog or a cat. So what do, right?
Right.
We found that we had so many people asking us in the beginning if they could use our products on their pets that I said, there's clearly a need for this. And I have a lot of
Right.
dogs and a lot of rescues, 4 dogs, cats, we got a pig, chickens, I got tortoises. We've got a lot of stuff here. So we've definitely used it on them also. And I was like, oh, this seems, like there's a need for it. And so I think it was only a year after we launched commercially that we added the animal products, and they've been our number one sellers on Amazon since 2014.
That's fascinating. And so,
Yeah.
do veterinarians even recommend it?
Yep. Yep. And we actually have a
That's
large animal
phenomenal.
line too that we sell for horses and livestock. And we sponsor the Kentucky Derby. I get to go play with the horses, which is fun. yeah.
That is amazing.
Yeah.
Really, that is a wonderful focus. And on the medical side of the house, you're focusing on all kinds of applications with plastic surgery and dermatology
Mhm.
and military,
Yes.
which I find
Yes.
fascinating.
Yeah. So we have our prescription strength formulas that we have on the KeriCure
Mm-hmm.
Medical website. And that basically is targeting those major wounds. So
Mm-hmm.
we're looking at chronic wound care where they have biofilms, like really old wounds that aren't healing. We've gotten to heal with our products. Pressure injuries, diabetic foot ulcers, those types of things. And then burns, obviously. I was able to get back into burns, which has been fantastic. And we were just at the
Mm,
American Burn Association conference, and that was a great experience. One of the most fun ones for me because it doesn't take a lot of explaining for the nurses to go, oh, I don't have to touch the burn. I just can spray it.
exactly.
This is amazing. And I'm like, exactly, because burns are so painful and you don't want to have to
Mm-hmm.
physically take off a dressing and scrub it every time. So if they can
Mm-hmm.
just spray, apply, and respray,
Mm-hmm.
and they're getting those benefits of the same type of benefits as their standard wound dressing, but you have antimicrobial silver in it, you've got lidocaine for pain, all in one, they're like, this is brilliant. So we had a lot
Mm-hmm.
of fun at that conference. When people get
That's
it that
fun.
quickly, it really is nice, and it makes me like affirms what we're doing, and that there is a need for it, and these nurses who are dealing with burns every day, some of the most challenging wounds to manage, got it, and we're excited about it. So that was great.
Well, and not only that, but the actual patient experience is going to be so much better.
Right. And that's the key, is getting that pain level down for the patients. And so one of the things we've noticed since the beginning with our products is that we get really good patient compliance with
Mm,
it. Say your child gets a burn, you don't want to touch it. You know it's going to
no.
cause pain. You don't want to do the
Mm-hmm.
dressing changes because it's going to be traumatic for them.
Mm-hmm.
So if you can do something where you can just spray it and they don't have to touch, then it's so much easier and it's so simple to use. We get really good patient compliance because of that, because they're like, oh, I don't have to slather some ointment all over me or something gross. I can just do a couple squirts and then it dries and then we're good. So we see that often, and that's beneficial because one, it's helping that patient heal and do things the right way. But two, they're not coming back to the hospital with a reoccurrence or a reinfection or something because they followed the protocol they were supposed to.
That's phenomenal. And so, Kerriann, what has your experience been with building the KeriCure business itself with your specialization as a scientist?
Yeah.
I'm wondering what the experience with scaling a business and creating demand has been like for you.
Yeah, it's definitely been interesting. My dad was a businessman. He worked and built his own company. He worked for Apple back in the day for Steve Jobs when they were first starting out. So
That's great.
he got computers into the elementary schools in my neighborhood. So he was running their K through 12 division to put computers in schools back when we didn't have computers in schools. Yeah. So I was, able to help and train people on using computers in like third grade. But no one really knew how to do that yet. But he ended up building a business on his own and sold it to Toshiba, and they kept his company in place with his team managing it. And he ended up being the president and CEO for Toshiba North America before he retired. So he was always the business person. Yeah. He was the business guy. I was the scientist. Mm-hmm. I was like, I'm never going to do business. No, I don't like business. And then, here I am.
I bet he's been a good mentor to you then.
Yeah. And he was one of the first champions for us, helping support our fundraising in the beginning. And, definitely it's been beneficial having him on board. I think he came on as a board member for us in around 2017 or so. When he first retired from Toshiba, and of course had more time to help. Mm-hmm. But it's definitely been challenging. Retail business is a challenge in itself.
It's hard.
Scaling marketing and figuring out how marketing's changed since we started in 2013 to now is drastically different.
Huge.
Yeah.
It's huge.
I mean, it's not like you can put a press release out and everyone sees it.
Right.
It's different how you get communications out there about new things you're doing. We just got our 510K for Field Shield, our FDA clearance on it back at the end of July. And how do we promote that? LinkedIn's been a big benefit for us, but it is definitely, we did take a big risk business wise. And that was one of the things that kind of shaped our company. Was in 2017, I kind of looked and said, we really need to get into the medical space. That's what our board,
right.
What our investors, we sold them on. We know that's where we can have the most impact. It's great to help with first aid and over the counter stuff. And there's a big need there. We knew there was a need in the market, and that's why we did it. But, for me, the real impact is on the major wound care. And so I wanted to get back to that, but we needed to expand our technology. We needed to have more than just one SKU, one product. And so we made the conscious effort to scale back our retail, pull out of the brick and mortar stores and kind of survive only online with our retail, so that I could focus my time and efforts in expanding our technology and our product portfolio. Mm-hmm. And it took about 2 years, but by 2019, we had a nice build out of products and technology. We added an antimicrobial line into there. And then a year later added the lidocaine. And that's when we were able to get back into the medical space and really do a strong launch in the professional wound care market, as well as get interest from the military at that point. Because then we had something that was really unique that no one else had, not just a spray-on bandage, but this really unique combination wound dressing that had everything that they needed in it to treat wounds in the field and in austere environments on the front lines when you don't have a hospital or you're not getting to a hospital for a day, 2 days, 3 days. It changes the dynamics of wound management. And because we're a spray, we can treat many wounds, not just one. With one product, where most of the dressings are fabric. It's one wound, one sheet, one dressing. So we joke with the guys, we're like, we're care multipliers, and they love that because our one bottle treats many. So it multiplies. And, DOD and the military right now are really big on force multipliers, things that can enhance our guys' capabilities and strengthen us. And so they love that we always joke we're a care multiplier for them.
That's fantastic. And so I'm assuming focusing on the medical side of the business, that's been a tremendous expansion.
Yes. And it
That's
definitely takes a
great.
lot of time and resources too, but it's an area that we see the biggest growth potential also and ability to help. So,
Mm-hmm.
yeah, it's definitely been interesting, navigating the professional medical market from a business standpoint and not wasting time and resources in areas where it's not quickly received or where you have a lot of roadblocks. But I think we've been being strategic with how we approach things. And one of the things that we've said from the beginning is, hey, we're a biotech company as its
Mm-hmm.
core. We are not a marketing sales company. So
Right.
we look for strategic partnerships on that end to grow and expand. So working with companies, we have a couple of private labels where it's people put their names on the products and technology and sell it under their brand, which is great. It's getting out
That's
there.
wonderful.
They have their brand recognition. So why would we force our name if they already have it?
Right.
We're more about getting it out and getting it in the hands of people that need it versus us having an ego with the brand name. I did not pick this name, by the way. I didn't pick KeriCure. My board did it.
That is a fascinating story. And honestly, even picking the name and it being a play on your name, I do love that.
Well, we were targeting moms in the beginning, as a first aid product for kids. And that was kind of we wanted to be the kid friendly version of what was on the market. And so everyone just kind of said, put your name, like, let's make it KeriCure because they'll connect and resonate with the moms. And I was like, oh, geez, really? But
I think it's great. I really do.
yeah, so it's always been a joke. I'm like, it wasn't me, I swear. It's not me. I was like, I had a list of like 20 names, and my girlfriend, who was a marketing exec for Bic, said KeriCure, and I was like, no way. And sure enough, every single one of our investors voted for it, and I was like, you're kidding. So that was it. I couldn't say no. They all voted for
That's
it.
right. That's right. And so, are you working on any new products for areas with critical needs now?
Yes. So we've been working with DHA, which is the Defense Health Agency, since 2020. I actually won the Army's X-Tech search. I was a top 10 finalist and got 145,000 in prize money from them as part
Nice.
of launching us into the military medical space. And
Nice.
since then, we've developed a lot of really great relationships with people in the military medical industry and listen to their issues and their pain points and their capability gaps and what they need for the future fight. And so we have
Mhm.
some things in the pipeline that we've been working on with them, really specific for their needs, some new iterations of our current products, and then also expanding our FDA indications for use to add indications for stuff that they're looking at for future. Maybe not necessarily our future, but things that are coming that we would want to help with, like chemical bionuclear issues.
Yes.
So treating mustard agent burns, chlorine gas,
Mhm.
viral threats in wounds. Yeah, some crazy stuff. So
Mhm.
luckily for us, our silver works
Mhm.
against a big host of things. And we're very helpful with the lidocaine with painful blistering burns like mustard agent and chemical burns. So it just makes sense. And because, like, again, I said, we're a spray, we're easy to use. I always joke that my 7-year-old sprays herself, so these big military guys can do it easily with a little
Mhm.
training. And those are kind of the key things that make sense for the military because they need something that anyone can use. We're not going to have to train them for days on how to apply this and use it correctly.
Right.
And that'll help seal and protect their wounds and help, provide some pain relief, antimicrobial until they can get to, a hospital and surgical needs.
That is a very high value situation when you don't have to train people extensively. I mean, that is just huge.
Yeah. Yeah,
It could literally go in every single person's backpack.
that's what I'm trying. That's the goal.
Literally.
So I'll tell you, they call it an IFAC. It's an individual first aid kit. And so every warfighter has one. And it's very hard because, they have so much heavy stuff they carry.
Oh, yeah.
So just to add anything is difficult. And so, it is an uphill battle, and it's something that we're very passionate about and I think would be a huge benefit to them. But it's just convincing the top level to swap something out to put us in. But the fact that we could, you can have this one little itty bitty, I mean, it's ridiculously small,
It's
a half-ounce bottle in
wonderful.
your bag,
Yeah.
and this could treat 5 to 10 wounds. They don't have anything like that. So
It's a no-brainer.
yeah. Well, our government's not always the best with no brainers. They just make it as complicated as possible. But
you're cracking the code though, because you've come so far in your work to set up commerce between you and the military. You have all these stock numbers. You are listed as a preferred provider. You've come a long way.
yes. Yeah, it's definitely been, the past 4 years in education for us as well. I've always had an interest in working with the military because of burn care, and they really just don't have anything good for field care for burns. It's pretty much ignored, honestly, because it's not life threatening at that time in the field. But what's happening is they're coming home with these, by the time they get to fixed care, they get to that hospital, they have this massive infection they've now got to deal with. They're losing limbs because of it, because it's so infected that there's nothing they can do. And we could be such a simple solution that takes little to no effort to prevent that from happening. So it's like, we're figuring things out still every day. I learn something new and there's a new area, there's a new buyer, there's a new way that they can order from us that we've got to figure out. But it's been very rewarding, and getting to work with the guys and the medics, the PAs, getting to work with the Army Rangers is my favorite. Getting to go to the best ranger competition, I always have a blast. And this year I got to actually be in the medic tent and help take care of them after they cross the finish line and treat their blisters and their rope burns and their friction burns. And there was a couple of pretty bad ones that I got to jump in and help with. And that was really, for me, that's the fun part, is getting to see the benefit and helping get our military.
Absolutely. It's super rewarding. And so, Kerriann, what big leap are you working on in your business right now?
So right now we basically have spent the last 12 to 18 months in putting together all of the key components to launch in medical and military. So we were pulling together a sales team, a team of sales reps for the civilian side and the hospitals, the burn centers, the wound centers, home health care, getting those guys together, getting all of our pricing figured out, all of our SKUs, all of our marketing materials, and then getting on the military side, getting on all of the different selling contracts like the GSA, the ECAT, getting our national stockpile numbers, our NSNs. So we pretty much have dedicated the last 18 months to making sure that all the key pieces were in place. So that way, once we hit go, we're ready to sell. And pretty much that's where we're at now. So now we're doing our hard launch this year. We did it at the American Burn Association conference. And then we were just at SOMA, which is the Special Ops Medic Conference, a couple weeks ago. And really getting the word out there and trying to promote the sales and distribution of the products in these industries.
That is very exciting. And so what events do you have coming up? Do you have anything else on the calendar?
Yeah, there's a couple. We have the EMS Expo, which is where all the firefighter EMS come together. We think that our antiseptic spray and then our field shield are two ideal products for them. To be able to treat at the back of the ambulances, or a lot of times, I think the stat is 80% of ambulance calls don't go to the hospital. They're treating on site and then they're releasing. So, we're a solution for that as well. And then we have a big one for the National Guard coming up too. this year, and trying to get the products into not just the medic kits and the first aid bags, but on base at the aid stations and for preventative care. So that's a big focus for us in the next year to 2 years is how can we make sure that our men and women that are going through the trainings aren't, they call it washing out, but essentially not having to go back through training because they got this blister that turned into this massive wound on their foot because it got infected. And then now they can't finish the course because they can't walk anymore and they need to get out and get medical care. So if we can get, our products in the hands of the students as they're going through training so that they can be treating their foot funguses or they can be spraying their blisters and their rope burns and brass burns so that it doesn't turn into these big nasty wounds so they can prevent washing out and completing their trainings. We think that would be a big benefit overall to our capabilities and, as they call it, our force readiness. So our ability to be ready for a conflict. That's a big area that we see growth opportunity and an ability to help by stocking the products on bases here in the States, as well as looking for it for use in medic bags as well.
And so it's going to be a really exciting time for you, basically the next 2 to 5 years.
Yeah.
That's awesome. That's incredible.
Thank you.
That's incredible. If you could build your business over again, what would you do differently?
Oh,
if anything?
Gosh. Yeah, I think that's a good question. As painful as it was to go retail to start, it taught us a lot, and I think it was a necessary learning lesson for me personally as the CEO and learning the business side of those things too, because it just prepared us for some of the larger contracts and conversations we're having now with, worldwide distributors for medical products and for military products. We're talking to North American Rescue. We actually just signed a contract yesterday with them as our distribution partner. And they're a global company. Thank you.
Congratulations. That's so exciting.
Yeah. So, I think, I never look back and say, I wish I did this or that differently. It's all been a road and a journey, and everything's just a learning experience and how to grow and develop from it. Obviously, we wish we would have gotten partnerships sooner in certain areas or found a distribution partner that worked out for the OTC space. We actually had a contract for private label that we thought was finished. We had spent a year on it. And the parent company was involved in the opioid crisis. And so
we had
literally just signed our part of the deal.
I'm so sorry to hear that.
And then they pulled it back because that whole bubble burst and the parent company went under. And so we lost out on that. So that was that one hurt. That one hurt for a solid 6 months.
That's very painful.
Yeah.
I think that you'll find another.
Yeah. And, there's always those experiences too. We've had quite a few of those where we get the deal done even, and then they just never move on it. And it's disappointing. And you just got to keep rolling and keep looking forward and keep looking for the next partnership. And one of them's going to work out, You just got to keep the faith.
That's right. What big goals and aspirations are you currently working on right now?
Well, my dream, my pie in the sky dream is to get our field shield in every IFAC. That would be the ultimate win for me. So that's my biggest goal. But, we're looking at growth and expansion through distribution partnerships, and then ultimately having the right partnership for acquisition where we can then continue to develop products under their brand, and just be, a key biotech piece and integral partner for someone larger who has that capability, who has that distribution and brand awareness in the market to kind of take our stuff to the next level. Because we know where our limits are, and we know it takes millions and millions of dollars to build a global brand, and we're not there. So that's kind of what we're looking for, is that right partnership.
And so when you look at the time frame that you think that you're targeting, what do you think that time frame is? Is it beyond 5 years?
No, I think because we've done so much of the legwork at this point, we really finally have that full portfolio of products now. I think we're looking at 2 to 3 years at the most. Yeah.
That is so exciting.
Yeah. I think we're finally there. It's been a long journey. I formed the company in 2011, and I fundraised for about a year and a half, and like hard launched in 2012. I always joke I birthed two babies in 2012, and KeriCure came first.
Wow, that was hard.
I was fundraising while pregnant, so
That was an intense year. And
yeah.
so you're really at a very intense time then if you see 2 to 3 years.
Yeah. Yeah. But yeah, so we've been on the market since 2013. So 12 years on the market and commercially available. So, I think there's an end in sight. It's, we still got some time and some building and some awareness, and we want to show adoption in the medical space and in the military space now. But I think once we have those, that's our next level is going to be acquisition within 2 to 3 years.
It's absolutely going to come together for you.
No, I appreciate that.
It is. It is absolutely going to come together. Is there anything else that you want to share today? Is there anything else on your mind?
No, I really appreciate this, getting to chat with you and reaching out. We love sharing the story and what we're doing now. I mean, we were a commercial product for so long and on the OTC space, and we haven't really talked a lot about what we've been doing in the medical and military because we've been head down doing it, So I finally get a chance to come up for air and breathe, and now we have, all of our products, FDA clearances, our NSNs, and it's like, okay, now I can talk about it. Now I can finally be like, hey, look what we've done the last 5 years, last 4 years. We've been building and building, and now it's like we finally get a chance to share what we've been doing. So I really appreciate you having me on and letting me share a story.
Absolutely, Kerriann. I think great things are coming your way.
Oh, thank you.
Absolutely. How can our listeners find you?
So we're available, like I said, on Amazon. You can just search KeriCure and all of our products come up, our KeriCure store, KeriCure.com. And then for the professional medical and military grade products, it's KeriCureMedical.com is where you'll find all of those. And then we're on all of the DAPA, GSA, ECATs, all of those fun things.
Wonderful. Well, thank you so much for your time today.
Absolutely. Thank you.
The 3 key takeaways from today's episode include purpose-driven innovation. Dr. Greenhalgh's nanopolymer technology was born out of a desire to address critical needs in wound care, especially for burn victims, children, the elderly, and even animals. Her products were designed to be as gentle and effective as possible, scaling through strategic focus. After starting in retail, KeriCure shifted towards e-commerce and Amazon, and most recently expanded strongly into medical and military markets. This strategic pivot allowed the company to optimize resources and impact where they are needed most. Listen and adapt. Many product evolutions, like adding lidocaine, came from real-life family experiences and customer feedback, including responding to veterinarians' needs for pet wound care. From getting FDA approval and working with the U.S. military to making a difference for families and pets at home, Dr. Greenhalgh's story is a reminder of what's possible when scientific rigor meets real-world needs. Thanks so much for listening today, and as always, subscribe and never miss an episode.